Hi there, my name's Leon Outar. I'm a chartered psychologist working at the private therapy clinic. My biggest areas of expertise include self-esteem and body image. So this is basically about helping people develop more favourable opinions of themselves. I also work with eating disorders, so essentially this is individuals who struggle with their relationships with food and wanting to restore balance there. Also as well, I work with weight management and health behavioural change. So this is if you are having troubles with obesity and have struggled in the past to find a remedy for that. I typically work with people to bring that. And finally, I work with stress management and burnout prevention. So this is basically busy individuals who are struggling with stress levels and really trying to find a remedy for that. So what happens in the first session with myself? So the first session is really built on looking at the history, where you currently are, and the future. So specifically, we've been looking at historical factors, what's essentially happened in your life to lead you up until this point. What's gone particularly well and what's not gone so particularly well, also as well, to lead you to where you are. We also were looking at current situations as well. So what is happening with this challenge at present and what sort of factors are maintaining this? Looking even more broadly at the social aspects of it as well. Who's in your life that essentially may be contributing to this also as well? And most importantly, what does the future entail? What are the goals that you would want to reach with us working together? And most importantly, based on the foundation of that is us building a real rapport. That is obviously one of the core ingredients of working well together. So it's about identifying if I'm the correct individual for yourself as well, who can support you. So what makes a good practitioner? Now, I believe there are 5 key factors of what makes a good practitioner. The first one is empathy. Now, I believe all good practitioners should be empathetic, should be caring and compassionate towards their clients' needs. The second one is congruence. Now, essentially this relates to providing openness and honesty, providing an environment of psychological safety for you to be able to disclose your difficulties in this safe environment. The third one is positive unconditional regard. Now, this basically means irrespective of your challenges, your habits, your behaviours, your particular thought patterns, that you will be not judged in any way, shape or form, that you have value and worth irrespective of these particular challenges. And the fourth one is about eliciting your strengths and positives. So essentially, when people are going through challenges, they often forget about a lot of the skills, the experiences that they can bring to the therapeutic approach. Now, as well as us working on your challenges and ensuring that we can attenuate them, it's also about bolstering those strengths, allowing you to thrive and flourish once you're coming out of this particular process. And finally, basic psychological needs. Now, as humans, we all have basic psychological needs of autonomy, connectedness, and also competence. Now, autonomy basically means you having free choice and control within the situation. Now, working together, we collaborate, we offer choice. It's not sort of a directional process where I dictate what happens. It's about us working together to find resolutions for your unique challenges. Also as well, when we think about competence, this is about skills. So it's about skilling you up so when you come out of this particular process, that you're able to apply this for long-lasting change. And relatedness is also about our rapport. It's again building those foundations of trust. So you basically understand that this environment is safe and that we can work together in a safe and a trustworthy environment. So is it usual or unusual to have psychological difficulties? Now, I personally believe psychological difficulties are highly normative. As humans, we often have physical ailments, colds, scratches, injuries, and we often have to seek remedy, being pharmacology, rest, or any other way of supporting that particular problem. And the same is with mental health. Mental health does not discriminate at all. Many of us go through vast experiences, adversities and challenges in our long lifespan. And it's highly normal for us to find difficulty in this and challenges in this and often develop unhelpful coping mechanisms. And this is where psychology and therapy is absolutely essential and why everyone really at some point in lifetime most likely should engage in therapeutic approaches. because this allows you to identify what's happened, to develop skills and strategies to be able to manage these in the now and also moving forward in life. So what are the approaches that I use? Now, I use cognitive behavioural therapy, the most evidence-based psychotherapeutic approach utilised by psychologists and psychiatrists. Now, CBT is utilised for a host of psychological difficulties, including eating disorders, self-esteem, depression and anxiety. Now, CBT, irrespective of which type of approach it is, being rational emotive behavioural therapy, acceptance commitment therapy or compassion focused therapy, often works around cognitions, behaviours and feelings. And what this is referred to as the cognitive triad. Now, when we have particular challenges, often they originate in our particular behaviours we're engaging in, and most importantly, some of the thoughts that we have. Now, how I utilise cognitive behavioural therapy with all of the particular expertise areas that I work with is identifying those unhelpful cognitions that you may be having. So when I say cognitions, I'm talking about the thoughts that you're having, how they relate to your behaviours and your feelings to keep you stuck in the cycle which is maintaining your particular challenge. And once we identify that, we then look at challenging, examining those particular thought patterns, developing new behaviours and creating new outcomes.